Hello everyone, my name is Martha Castillo and I will be presenting my research on sleep disorders. I want to thank Dr. Green for an amazing class and I hope you enjoy. What are sleep disorders? Sleep disorders are categorized as problems with the quality, timing, and amount of sleep, which results in daytime distress and impairment in functioning. Sleep-wake disorders often occur along with medical conditions or other mental health conditions such as depression, anxiety, or cognitive disorders. There are a few different types of sleep-wake disorders, of which insomnia is the most common. Other sleep-wake disorders include obstructive sleep apnea, parasomnias, narcolepsy, and restless leg syndrome, all of which I will discuss today. Sleep difficulties are linked to both physical and emotional problems. Sleep problems can both contribute to and exacerbate mental health conditions and can be a symptom of other mental health conditions. As mentioned before, insomnia is the most common sleep disorder. It is defined as problems getting to sleep and staying asleep. About 1/3 of adults report insomnia symptoms, and 6 to 10% meet the criteria for insomnia disorder as described in the CDC diagnosing guidelines. An estimated 40 to 50% of individuals with insomnia also have another mental disorder, which, as mentioned before, exacerbate their insomnia, and their insomnia, unfortunately, exacerbates their disorder. Who does it affect? Women are twice as likely to experience insomnia as men. Today, 50 to 70 million Americans of all ages and socioeconomic classes suffer from sleep problems. Older people are more susceptible to insomnia as well as those with learning issues such as attention deficit disorder sufferers. Symptoms of insomnia are categorized in 3 sections. People with insomnia experience daytime sleepiness and may have difficulty functioning while they're awake. Chronic insomnia is diagnosed when someone has these symptoms at least 3 times per week for at least 3 months. And it can occur at any age, but most commonly starts in young adulthood. So, how would we go about treating insomnia? Step 1 is to identify the problem. As medical professionals, we have to rule out medication side effects, substance misuse, depression, and other physical and mental illnesses, which can demonstrate as insomnia, but are not insomnia. Step 2, take a holistic approach. Mental relaxation techniques before bedtime, such as meditation, melatonin supplements, and physical relaxation, such as yoga and acupuncture, have shown to decrease insomnia symptoms. Step 3, have proper sleep hygiene. Sleep hygiene refers to basically what we do during our bedtime routine. One should stick to a sleep schedule, wake up at the same time every day, even on weekends. Avoid electronic devices 30 minutes before bed, as blue light is harmful to your eyes. Exercise daily and avoid alcohol and caffeine before bed. Obstructive sleep apnea is categorized as a sleep disorder which has breathing interruptions during sleep. Symptoms of this disorder are repeated episodes of airway obstruction, interruptions during sleep, causing snoring, gasping, and breathing pauses. Interrupted sleep causes daytime sleepiness and fatigue. Sleep apnea affects an estimated 2 to 15% of middle-aged adults and more than 20% of older adults. Major risk factors are obesity, being male, family history of sleep apnea, people who take opioid pain medications, adults over 60 years old, and people with heart conditions such as atrial fibrillation and congestive heart failure. The most effective course of treatment for sleep apnea is weight reduction to reduce obesity, a CPAP machine, also known as continuous positive airway pressure device, and a mouth guard, which will clear the airways and allow for better breathing, which in turn will decrease the amount of times that someone has an interrupted sleep cycle, decreasing daytime sleepiness. Parasomnia, or as I like to call it, paranormal insomnia, is a sleep disorder that involves unusual and undesirable physical events or experiences that disrupt sleep. The best way for me to memorize this is basically because you feel like you're in a horror movie while you sleep. Unfortunately, this is a quite severe sleeping disorder, which has nightmares, night terrors, bedwetting, and sleepwalking as its main symptoms. Nightmares and bedwetting have a higher likelihood of affecting children, while night terrors and sleepwalking are more likely to affect adults. Parasomnia affects between 10 and 15% of the world's population. Now, the main difference between night terrors and nightmares are that they happen during different times of sleep. Night terrors usually happen when you have just gone to bed and you've probably been asleep for a few hours. Usually, although you will have certain instances of talking or moving, by the time that you wake up, you won't really remember them. Now, nightmares are in a deeper center of our sleep cycle and can usually be remembered in the morning, and are not usually as severe as night terror episodes, although they can last longer. The two best treatments for treating parasomnia are medications and creating a safer sleep environment. For medications, the usual prescriptions are antidepressants, melatonin, and benzodiazepine, which is also a depressant, which is usually used to treat anxiety and insomnia. Now, creating a safer sleep environment, one would do scheduled awakenings, wake up at the same time to have a sort of routine and a sense of safety, sleeping alone, locking doors and windows. Surprisingly, this is also seen in people who have obsessive compulsive disorder, in which they have nightmares if they have not done their usual daily routine, which usually involves locking doors and windows. So this is a way for the patient to feel safer and also have a better sleep cycle. As well as with medication, and creating a safer sleep environment can adequately help people who suffer from parasomnia have a less severe and, in time, cease all episodes. Narcolepsy is a very interesting sleep disorder in its spontaneity. So it's a condition where your brain can't control your ability to sleep or stay awake, and its most notable trait is the urge to fall asleep suddenly during the daytime, which is almost impossible to resist to those suffering from the sleep disorder. There's people who have fallen asleep while driving, unfortunately, people who fall asleep while walking, as we see in the picture, people who fall asleep during eating. It is kind of like turning an on and off button on your TV. It happens instantaneously, and although a lot of the times they try to stay awake, they simply cannot control the way that their brain receives those signals, causing them to simply fall asleep immediately. So the main symptoms are excessive daytime sleepiness. It happens to everyone in narcolepsy, and it's uncontrollable sleeping episodes. Sudden muscle weakness, also known as cataplexy. It can affect one part of the body or all of it. Sleep-related hallucinations. These happen right after falling asleep or right before waking up. And sleep paralysis, where one wakes up unable to move. Now, during sleep-related hallucinations, it usually stems from the fact that the person doesn't really have a period of de-escalation between being awake and being asleep. There's no transition period. So a lot of the times they will hallucinate where they finished eating even though they fell asleep or got to where they were going. They will dream about completing the tasks in which they inevitably fell asleep towards. Who is at risk? Those with family history of narcolepsy are at higher risk. Men and women are thought to be affected equally by narcolepsy. However, some studies have suggested that the condition may be more common in men. Narcolepsy may also occur after an upper airway infection, or rarely because of a head injury, sarcoidosis, a stroke, or another medical condition. And this is believed because it affects a certain location in the brain, which these type of injuries or infections can cause a difference in the way that the brain reads neurological signals. Treatment is, unfortunately, narcolepsy is not curable, but treatment usually starts with medication, but changes to lifestyle can also help. However, it is not a disorder which can be treated just by changes in lifestyle. Usually, medication is the best course of action, but it is a lot more successful with changes in lifestyle. Its main treatment would be stimulative medications such as modafinil, amphetamines, and antidepressants. Amphetamines are incredibly important in this treatment since they control the nervous system and are also used to treat learning disabilities like ADD. It helps stimulate the part of the brain that keeps the person awake. Next, we have restless leg syndrome, a condition characterized by nearly irresistible urge to move the legs, typically in the evenings. Restless leg syndrome typically occurs while sitting or lying down. It generally worsens with age and can disrupt sleep. It can disrupt sleep because the person feels this incredibly urge to move, even while sleeping, sometimes waking them up or causing them to not be able to sleep properly. The main symptoms, as mentioned before, they reserve an urge to move, uncomfortable sensation in the legs, sensations that begin while resting and can typically feel like pins and needles or numbness. You feel a lot of relief with movement, and the sensation lessens with the more movement that you do. Now, the worsening of symptoms happen in the evening because this is when most people happen to be sedentary. RLS can develop at any age, even during childhood. The condition is more common with increasing age, and it is more common in women than in men. Treatment for this disorder is medications that increase dopamine in the brain, drugs affecting calcium channels, muscle relaxants, and sleep medication, as well as opioids. Both which are considered to be pain relievers and will help the pain of the symptoms surrounded by RLS, those pins, those needles, that aching in the legs, which in turn can help the person not shake as much and enjoy a better quality of sleep. Lastly, we have the references which I use for this presentation. I hope you guys enjoyed and that it was very informative. Thank you for your time.